More recently, we've been able to deal effectively with the over 40 to 45 age group who've lost their focusing power. So the big advance in laser refractive surgery in our clinic over the last few years has been the introduction of blended vision, which involves making the laser refractive surgery somewhat multifocal, so people can still see well at near and in the distance without glasses.
Blended vision is a major advancement in laser refractive surgery. It works by increasing depth of field in both eyes. This allows the dominant eye to see distance and intermediate, and the other eye to see near and intermediate, creating a blending of vision that gives both eyes similar vision.
Well, the evolution of laser refractive surgery is the story of my professional life. Throughout the 80s, everyone was evolving in eye surgery the idea of putting intraocular lenses in the eyes and making them optically perfect, as well as getting rid of the cataract. Well, that naturally evolved into the ability to make people optically perfect, even sometimes when they didn't have cataracts. Those technologies began to become more significant for normal, healthy-eyed people.
Until recently, the only laser treatment for presbyopia was monovision. That is, correcting only the dominant eye for distance and leaving the other for near vision. With laser blended vision, the process has been taken one step further.
We're doing 2 procedures today on both men who are somewhat nearsighted. They have myopia, and we've measured exactly the degree of myopia and the optics of the situation, both digitally and topographically, in ways that are not normally measured in a routine eye examination. We've fed all that into the pre-operative device that actually does the programming for their particular laser treatment on each of their eyes. We have their digital chip prepared for each of their eyes, which we will put right into the laser, which reflects the same pre-op testing.
Prior to entering the room, numbing drops are placed into the patient's eyes.
Whereby a flap is raised under the surface of the cornea. The treatment is undertaken to change the shape of the cornea under the flap, and then the flap is put down.
The actual laser treatment only takes 20 to 60 seconds, and patients can expect to see at a 20/20 level 1 day post-operation.
I mean, it was 99% of the time was just the preparation. The whole procedure was over within, 2, 3, 4 minutes?
We're wearing glasses for 34 years now, so it's nice to see without it.
So we've had more than 20 years under our belt of doing this, and the engineers and the technologists have helped a lot. It's been a huge synergistic effort. So I think there are now tens of millions of these surgeries done every year throughout the world.